live virtual town hall meeting to honor each of you and to celebrate Women's History Month. My name is Andrea Simpson. I'm the Women Veteran Program Manager at the Kansas City VA, which is one out of our 8 medical centers within our VISN area. This includes Columbia, St. Louis, Wichita, Poplar Bluff, Marion, Kansas City, Eastern Kansas, which is Leavenworth and Topeka together. I want to take a moment and say on behalf of your VISN 15 Women Veteran Program Managers and several others on this call, thank you for your service. Your sacrifice to our country does not go unrecognized by any of us. I, too, am a female veteran, and we are joined this evening by a team of wonderful people that stand behind our mission to bring quality health care to you. In addition, I would be amiss if I did not take time to recognize Cindy Stivers, Columbia Women Veteran Program Manager, who not only took the lead to organize our evening, but is also a woman veteran. Thank you, Cindy. Thank you for joining us this evening. We're so excited you joined us, and we very much appreciate you attending tonight. We're aware of busy schedules, and we just want to say thank you for that. We're hosting this evening tonight specifically for you. We want to hear your voices and provide the opportunity for you to speak directly with us. What you can expect tonight is the national anthem, followed by a moment of silence for our fallen brothers and sisters in arms. We will then have a brief overview of several VA and community programs that will be beneficial for you to know. We will have some polling questions in between our speakers, and you will have the opportunity to ask questions, voice concerns, and share hopes for your health care throughout our interaction. At the end of our meeting, we will address some of your questions. We have scheduled 60 minutes, and we're looking forward to hearing from you. If you do have a question, you can press *3 on your iPhone keypad at any time, and you will be placed in line to speak with a member of our staff. Also, if you are wanting to watch the PowerPoint slides, you will need to press *8 on your iPhone keypad, and a link will be sent to your iPhone. Members of our staff will take down your name and where you're calling in from, along with your question. At that time, your question will be forwarded so we can address them for everyone to hear in case another veteran has a similar question. We also want to express in advance that we may not have time to respond to each question, but please understand it is due to time constraints and nothing else. If you desire a response to your question that we did not have time for tonight, another option is to call the Women Veteran Call Center. I'll provide more information on the close of this evening about that. So again, press *3 on your iPhone keypad for questions. Press *8 for a link to be sent to your iPhone PowerPoint. All right, so at this time, I know we're all at home and at work, but I want to ask you to please stand in honor of our national anthem that will be sung by Jamie Falcon. This will be directly followed by a moment of silence for our fallen brothers and sisters in arms. Would you please mute your phones at this time? And Jamie, it is all yours.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets regular, the bombs bursting in air, gave proof to the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of
Okay. Thank you, Jamie. That was absolutely beautiful. And again, we want to say thank you all for your service to our country. So let's have some fun. We'll do a little bit of interaction by responding to our first poll question. If you're on the phone, you can vote by pressing the corresponding number on your keypad that matches the closest VA that is near you. If you cannot see the slides, I'll be reading them to you. And then I'll share the poll just so that we know where everybody's from and just kind of share that. I think that it's a fun thing. So question number 1, at which VA healthcare system do you receive your care? Number 1, John Pershing, which is Poplar Bluff. 2, Harry Truman, Columbia. 3, St. Louis. 4, Marion. 5, Kansas City. 6, Eastern Kansas, which will be either Leavenworth or Topeka. And then 7, Robert Dole, which is Wichita. All right. It looks like we have 487 voting. Looks like, let's see, there's 135 from St. Louis, 103 from Kansas City, Eastern Kansas 83, Wichita 54, Poplar Bluff 32, and Columbia 60. So thank you all. That's 512 of you that are on here today and have taken time out for tonight. So wonderful, wonderful results. A quick reminder again, just to mute your phones while our presenters are speaking so that we don't have the background noise. And at this time, I'd like to welcome and introduce your first speaker, Ms. Candy Miller, who is the VHA's Interim Medical Director at Poplar Bluff and also a veteran. Ms. Miller?
Well, good evening. As an Air Force veteran and a nurse, I am pleased to represent the Veterans Health Administration this evening at this virtual town hall, which has been specifically designed for our women's veterans. We've come a long way in healthcare for women's veterans. The Department of Veterans Affairs is very focused on ensuring all women veterans are treated with dignity and respect. Women who served in our country's military deserve to be treated with honor, just as their male counterparts. The Veterans Health Administration expects agency-wide respect for women veterans and has recently redoubled efforts to address the issue of harassment. Harassment disrupts both access to care and the overall veteran experience, and we have many programs and processes to address this issue. Through action and accountability, we can and will make a significant impact on veterans' experiences when they visit VA sites of care. VISN 15 is here to meet your healthcare needs, all of them. If you need us for general overall primary care, wellness checks, routine screenings, chronic disease management for diabetes and COPD, pain management, or mental health counseling, we're here. We know that our women veterans come in all ages, and we cater to their needs. We have trained designated women health care providers at each location. If you need us for reproductive health care, anything from birth control to infertility treatments to menopausal care, we are here. If you need pelvic floor therapy or lactating classes, we're here to serve you. If you have or need cervical care, cancer screenings, military sexual trauma counseling, or specialty services, we're here for you. If you need mammography or post-mastectomy prosthetics, we're here to serve you. We have whole health opportunities such as yoga, tai chi, battlefield acupuncture, and so much more. Our women's health providers can discuss these options with you during your next appointment. We offer face-to-face appointments, virtual appointments, and an online healthcare management interface called My Healthy Vet to provide you with care at the right time and in a way or location that is convenient for you. Busy women veterans can order their prescription refills, see their lab results or medical records and send online secure messages to their providers. I hope all this will show you that we've changed and we're no longer just your father's VA. Let us be here for you. If you're not yet a VA patient, please consider choosing VA for your healthcare needs. If you're already a VA patient, thank you for choosing VA. We know you have options, but we think we know and care for our veterans better than anyone. Thank you.
Thank you, Ms. Miller. Our next speaker is Natalie Berry. She is our Women Veteran Coach from VBA, Veterans Benefit Administration. Natalie?
Hello, can you hear me?
Yes, we sure can.
Hello, my name is Natalie Berry. I work in the Veterans Affairs Regional Office here in St. Louis, located at 9700 Page. You can find me and my fellow colleagues in the Public Contact Office. I want to inform you that you can apply for VA compensation for any injury or health problem that manifested while you were on active duty. This includes any military sexual trauma that occurred. Please know that you will not be penalized nor suffer any backlash for telling your story and seeking deserved compensation for any trauma you experienced. All VA regional offices have a military sexual trauma coordinator on staff. VA pension was designed to combat homelessness after World War II. So if you have served during wartime and your total household income is less than about $1,200 a month, you may qualify. Survivors of wartime veterans can also apply. You cannot receive both compensation and pension benefits at the same time. Know that any VA decision can be appealed or challenged at any time, either through directly coming to the VA regional office or by going to your veteran service organizations. They are there to support you. VA offers burial benefits as well for veterans with an honorable discharge. For all those veterans who do not have an honorable discharge, we may be able to assist you with updating that discharge. VA insurance is also available for veterans and their family members. We offer educational benefits to include the GI Bill if you've paid into it during your active duty service. We also offer vocational rehabilitation for all those veterans who have a service-connected disability and have difficulty returning to work. This includes paying 100% of your books, fees, and tuition and providing you with a stipend. If it is determined that you are 100% permanent and totally disabled, your dependents may also be eligible for educational benefits. We also offer a VA home loan guarantee to encourage lender financing in our local communities. The best way to find out about all VA benefits is to go to the online portal, which is www.va.gov, or by calling 1-800-827-1000 from anywhere in the United States. You can reach a contact center to assist you, or by visiting your local VA regional office, or visiting a local veteran service organization. There are several housed here in our St. Louis regional office that are able to assist you. Come by and see us. We are happy to assist you. We appreciate your service. And like I said, my name is Natalie Berry, and you'll definitely be a face that you will meet if you come into the St. Louis regional office. Thank you.
Thank you, Natalie. Great information. All right, so our next poll question, keep the interaction going. What keeps you from utilizing the VA for all your healthcare needs? Choose what is your best answer. Number 1, distance, so travel time. 2, unaware or uninformed of the services. 3, utilize my private insurance. 4, previous bad experience with prior VA services. 5, nothing. I utilize the VA for all my health care needs. All right, so I'm going to read the poll. We had 372 that responded. Thank you all for that. 32 of you said it was distance. 43, you were unaware or uninformed of the services. 41 of you said you use your private insurance. 59 said you had a bad experience with prior VA services. And 228 of you said nothing. You get all of your health care at your VA. Thank you guys for participating in that. Oh, now it's jumping up. That's great. Went to 414. So thank you guys for that for sure. All right. So we are going to keep moving forward. And at this time, I would like to welcome and introduce Stacy Anastasia. She will be speaking about the Missouri Veteran Cemetery Program and other VSOs.
Good evening. I am honored to be here with you this evening. I am joined on the call with Lindsay Ward. She's a Veteran Service Officer out of the Columbia area, and she should be joining us at the end for the Q&A portion. I appreciate the opportunity to share some information about the Missouri Veterans Commission and its programs. The Veterans Commission has created a network of veteran cemeteries, homes, and veteran service offices so that every Missouri veteran will have reasonable access to benefits. From the initial concept of the Missouri Veteran Cemeteries, one operational philosophy has remained constant: to honor our veterans for their service and sacrifice. There are 5 veteran cemeteries in operation at this time: Springfield, Higginsville, Bloomfield, Fort Leonard Wood, and Jacksonville. The eligibility requirements for interment in a Missouri veteran cemetery are the same as that for a national cemetery. The veteran must have been discharged from active duty under conditions other than dishonorable and have completed the required period of service as required by law. Their death occurred while on active duty or after September 7, 1980 for enlisted, and after October 16, 1981 for officers. They must have served 24 consecutive months on active duty or the full period for which they were called to active duty. Reservists or National Guard members who are eligible for retired pay as a result of 20 years creditable service, and reservists and members of the National Guard who are called to active duty by presidential executive order and who satisfactorily completed the period for which they are called are also eligible. U.S. citizens who served in the armed forces of a government allied with the United States during wartime may also be eligible. There is no residency requirement for interment in a Missouri Veteran Cemetery. Burial benefits include opening and closing of the grave, a concrete grave liner if a vault is not purchased, upright granite headstone or niche cover, military honors for the veteran, and perpetual care of the grounds. These benefits are provided at no cost to veterans, their spouses, and their eligible dependents. Pre-planning for future burial is available at each cemetery, and you can contact the cemetery nearest you for further information or by submitting a pre-certification application that's available online. You must include a copy of your DD-214 or your military discharge showing character of service and your dates of active service, and a marriage license if you desire your spouse be interred with you. Interment services are scheduled Monday through Friday, and if you have specific questions regarding scheduling, we would encourage you to reach out to the nearest veteran cemetery, and they can definitely answer any questions that you may have. Another program that the Commission offers are the Veterans Homes. The Missouri Veterans Homes program manages over 1,200 beds that provide long-term skilled nursing care in compliance with Federal Department of Veterans Affairs regulations. There are 7 homes across the state, and they are located in Cameron, Cape Girardeau, Mexico, Mount Vernon, St. James, St. Louis, and Warrensburg. And finally, the Veteran Service Program. Through the Veteran Service Program, accredited Veteran Service Officers, or VSOs, provide counseling and assistance to thousands of veterans and their dependents throughout the state. These trained professionals counsel veterans on available VA and state veterans benefits, but they also complete and submit the applications with all the necessary documents on your behalf. To find your local VSO, call 573-751-3779 or visit the website that is listed on your screen. Thank you again for the opportunity to share with you this evening. I am truly honored to be with you. Thank you.
Okay, thank you, Stacy. Great information. And our next speaker is Kat Cortico. She is going to be speaking to us about VISN, which is a Women Veteran Network. Kat?
Good evening, everyone. Thank you so much for having me, and welcome to all the women veterans in this town hall. I am an Air Force retiree, and in WOVEN, the Women Veterans Network, we honor all women, regardless of when you served, regardless of how long you served, and regardless of your discharge. We have women who in our network who have served as far back as Vietnam. And it doesn't matter how long and out. I was one of the original 6 peer leaders back in 2017, and I am now one of 2 national consultants with the Women Veterans Network. We are always open to inspiring other women. We want women to understand that we are here. So what we do best is connect women. And so our mission is to provide a unique social network of women veterans to foster connections and build relationships in local communities and across the nation. So what we do best is we connect women. When you have a network, you feel like you've got this safety net of women who are, helping you along. And so you feel like you have what you need to keep going forward. So WOVEN seeks to empower women veterans by providing information, education, and resources to improve quality of life. Women veterans connect with WOVEN through in-person groups, virtual participation in groups, and online national forums. When we talk about our groups, we talk about structured. It's a structured group, so we're just not talking mindlessly or gossiping. So we talk about transition. We talk about balance. We talk about connections, and we talk about trust because we found that all of this is important to us. And so we find that when we are in these meetings and we're connecting with women from across the nation, especially if it's online, and you have this bond, which we have already because we are veterans. And so it's just a matter of getting to know each other. It's flexible to meet varying group needs. The conversations and topics are things that we already know. If you think back to your transition, how was that for you? So we talk about those things in a nice, safe type of environment so no one feels like they're being left out and no one feels like you have to talk, but if you would like to share, we more than welcome your share. We also have a lot of women from all different types of services. So we have the Army, the Marine Corps, Navy, Air Force, and Coast Guard. And we have a lot of the active duty women who talk about wanting to be a part of WOVEN. Now, WOVEN is for veterans, but we also have what's called Bridges, which is for our active duty women who are about 2 years out of getting out of the service. So imagine for those of you that got out, if there was someone that you could talk to who'd already walked that walk, how would that feel to know you had that person in your corner and that you could actually, bounce ideas off of them and find out what it was like and listening to other women talk about those types of things. When we first started in 2017, we had 6 cheerleaders. We had 2 from Charlotte. I was one of them. We had 2 from San Antonio, Texas, and we had 2 from Pittsburgh. and because there were large veteran presence there. And we have grown, if I tell you exponentially. Our goal is to have Woven as a household name. So you may not know what Woven is, but I want you to understand that when someone says Woven, you can say, I absolutely understand what Woven is and I know about it. So even if you're not ready to be a peer leader, maybe not even a group member, you can always subscribe to our newsletter. It's free. We will not spam you. You get one once a week. And we want you to stay in touch. You can also go on our Facebook community page. You don't have to be a part of Woven for that either. You can actually just be a part of the Woven page and just, see what we do, see the kind of things that we do and the fun that we have. Right now in March, we've got our 5th birthday coming up to the end of the month, and we also have a new peer leader training coming up. And so you can contact us several ways. You can contact via email. You can also contact us through online groups. You can always email your national consultants. The other national consultant is Tracy Rosado, whom some of you may know, and she's in Texas. And if you need to contact me, I'm kat@wovenwomenvets.org. And we're on all social media. And so when you look at the growth of women and being a part of the program, it's just really awesome to see the growth of Woven. So if you have any questions, please feel free. Thank you so much for having me. My name is Kat Corchado with the Women Veterans Network.
Kat, thank you so much. What a phenomenal program and network to have for female veterans. Our final presenter is our VISN 15 Women Veteran Health Program Lead and our fearless leader, Dr. Eve Olzemer. Eve?
Hi, can you hear me?
Yes.
Okay, thank you. Well, thank you to all of you for your wonderful service to our country. We're reminded of it daily and think about it daily as we take care of you and provide services for you. Within the United States, there's been a dramatic growth of women veterans across the nation. And I think you can see it in this slide that in the year 2000, we had less than 200,000 women veterans that were accessing the VA. It was certainly seen as the men's VA, but we really want to change that. And we want you to know that it really is no longer just a health care system for male veterans. This is your VA, and we really strive to make it allow for services to be provided that really help you and treat you at whatever stage in your life. There is almost 800,000 women veterans who do access VA health care now. It's been a tremendous growth, and we welcome you, if you are not currently seeking health care at the VA, to please give us a try, because we would be happy to serve you at whatever stage and whatever needs you have. We're happy to be available. We have women veteran program managers at absolutely every VA facility, and you can reach them by calling the operator at your local facility. So thank you again for your service.
Thank you, Dr. Olzemer. All right, our last poll question of the night. How would you like to receive information about your women's health program and facility updates? Number 1, email, healthy tips, newsletters, etc. 2, social media, Twitter, Facebook, Instagram. 3, VA website. 4, U.S. mail. 5, secure messaging, and that would also include my Healthy Vet, newsletters, education handouts. 6 is texting, health screen updates, and motivational messages. Okay. All right, looks like about 401 of you responded. Thank you for that. Looks like email takes the top with 165. Second is mail. Okay, that's great. Texting, yeah, that's technology today, 98. Secure messaging, 41. VA website, 15. Social media, 16. Okay. Thank you all for that response. I mean, we're definitely taking note of that and better ways to bring communication and what's happening. So that is really helpful on that. All right, so before we respond to the questions that you all have submitted, thank you guys for doing that for sure. I want to circle back around to the Women Veteran Call Center that I spoke of earlier today. And so this call center is, women respond to that, and it's also, it also has anything that you would have questions on, eligibility, any questions, like I said earlier, that we can't address tonight because of time constraints, you can call and somebody will respond to you within a 72-hour business day. So 3 days that would be consecutive business days. Somebody will respond to you at that point. So what we want to do is just really encourage you to reach out if you have questions. If you want to know, especially a lot of people want to know about IVF, and because that's fairly new to the VA, and how do I qualify for that? What about my spouse? All of those different things. So it's just a great number to call, and we would encourage you all to definitely get on and do that. And you can see the call number, and you can text that same number if that would also be helpful for you. All right, so let's go to our questions. And again, if you have any that you didn't ask in the interim of it, that's okay. You can still press *3, and we will do our best to respond to that. Okay, first question is from Karen. Can you expand upon who qualifies for VA life insurance?
The best answer I can give you would be to definitely call the life insurance phone numbers on the slide to make sure that you speak to someone directly. Please do not take any information from secondhand persons. Please contact the insurance agency directly, the VA insurance program, which is at 1-800-669-8477, and hear directly from the horse's mouth and get the most current, valid information possible. You can also go to va.gov, but I would actually call them directly and get the answers that you require.
Okay, thank you for that. Next question is from Priscilla. Why does our visits at the VA not reflect for service-connected conditions? I am being told that I have to go to an outside psychiatrist in order for it to count for her MST claim. I don't know where Priscilla is from, but can someone please respond to that?
This is Natalie Berry here with Compensation, and I'll just chime in and tell you that any medical evidence you have, whether it be from a private doctor, is helpful. Any evidence that you acquire from a VA medical center professional is helpful. Any kind of evidence you have to support your claim is helpful. Please know that whatever medical evidence you have is helpful for your claim. Know that if you did not address that situation right away once you were discharged, that it is going to require documentation to be developed. If you have evidence to submit, it requires any type of documentation to substantiate your claim. So any types of documentation you have would be helpful. It is also helpful for you to seek a veteran service organization to sit down with you and look at your claim, look at your medical evidence, and discern for you and help advocate for you in the best manner possible to make sure that your claim is actually handled in the best way possible. So any medical evidence, whether it be private or through VHA, is helpful, but just know the longer you wait to file your claim, the harder it is to push it through and discern whether or not it actually had anything to do with your military service. So the sooner you file your claim, the better.
Okay, thank you for that. And then I have another one from Christine, and giving a compliment to the CBOC at the Cape. It's amazing with all the amenities. Thank you for that. It's encouraging to hear for sure. We have one from Dee Dee. She just turned 65. Does she need to have Medicare and the VA or just the VA? Somebody from insurance?
Well, to be honest with you, it is truly up to you, and you will have to look at what benefits are most advantageous to you. You have to look at what Medicaid offers you and how much coverage you have. You have to look at what kind of coverage you have available to you under VA Medical Center, and you have to ultimately make the best decision for you and look at your finances and see where you best qualify and where you can get the most bang for the buck in terms of what will best support you and your medical needs.
Okay, thank you for that. Donna has a question about yeast infections, vaginosis, something like that. There is no way to get into the doctor's office right away. How do we go about getting immediate care?
And this is Eve, Dr. Holzheimer. I can answer that for you. You can get immediate care. You can look at the VA has a website that you can click to find your local urgent care centers that you can be seen at. The other thing is we have a clinical contact center that you can call, and you can have a virtual visit in real time, same day. And they will give you the best advice, guidance, or whatever. You will be talking to a practitioner who can prescribe medication for you also. And Andrea, I can look up those phone numbers in that website and provide those in just a moment, okay?
That would be great. Thank you for that. And this is a question from Andrea. She needs the phone number for Women's Health. How does the clinic see IVF for lesbian couples? Is that part of the VA? And that is St. Louis. Jen, if you're on.
Yes. Andrea, can you hear me?
I can, yep.
Yes, thank you. All right, Andrea, yes, I will put it in the chat box, but the Women's Health, you can also contact me directly, and we can talk about the various things. Yes, our medical benefits package, per directive, sorry, I'm giving you guys directives, but 1332, it supports fertility benefits and an infertility workup for male, female, no matter gender, sex, religion, everything. There's no just, it offers those benefits, and there's a list of them, so we can go through them with you. And I would be more than happy to speak with you offline, but we have a beautiful medical benefits package that I'm sure the other WVPM's on the phone call, but it goes over, it covers medications, consultation, your imaging, just everything that that would be required to do a workup and or to assist you and your partner getting pregnant. So let me, if I'll put in the chat box, our women's clinic number is 314-289-6540, but I'm also going to put my contact information in so that way we can chat about this tomorrow and just go into detail about the benefits. IVF has some very, there's some certain scenarios, especially you have to have a service-connected condition that is the causative factor for your infertility. That's one of the, and then there's a few other items. So, but your women's health provider at the clinic that you're going to or wherever you're going, they are also very aware of that. And we also have a gynecologist in-house here in St. Louis that can explain those benefits too. But by all means, please, I'll be happy to take those questions. And again, I just want to emphasize, sorry, I was trying to say this earlier, being in the VA for the last, 7 years, the, website has improved significantly. I mean, if you go to www.va.gov and type into the search box, you can find anything and everything. And there's so much information out there, and they've streamlined the website. So I know Eve was, with the urgent care benefit earlier, you can go to www.va.gov, find location, and then you can literally put in, hey, I need to find an urgent care, I need to find providers that are in network. Same thing for our community care. If we're sending you to a reproductive endocrinology fertility specialist, you can literally put in community care, and then you can select those that, reproductive or infertility or fertility, and find providers that are near you. So that way when our community care team staff call you, if you, have a provider that you would like to see that's in network, we can set you up with them, or it gives you just more knowledge. So I'm going to put my information in the chat box, Andrea, and we can discuss those benefits further, and I can give you more information. So I apologize for talking fast. I hope that covered it. Yes.
Yeah, and thank you for giving that website, because that is the website that they will use if they want to find an urgent care that's close to them as well, that they can access care and that's covered.
Okay. Great stuff, you guys. Thanks so much. We've got a question from Carolyn.
Before we move on, may I just say one more thing? Hi, this is Natalie from Compensation. I just wanted to make sure that everyone is aware that the language on our applications applying for benefits is also changing. So we are recognizing, too, that it's not just man or woman, that there are different ways of recognizing ourselves, and that our applications are changing, and we're listening to you.
Thank you for that. Absolutely. Absolutely. This next question is from Carolyn. She just moved to the VA. I'm not sure. Looks like a Topeka, Leavenworth number, maybe even Wichita. She was having a hard time getting appointments. She didn't know where to get information from, and she didn't get any help. One was a GYN within 25 miles that didn't work out. She doesn't know what benefits are available to her, and she cannot get a straight answer.
Hi, this is Heather. Can you hear me?
Oh, sorry, go ahead.
From Eastern Kansas. Yeah. So, Carolyn, I'll be happy to give you a call, and we can get you set up and scheduled. And I will give you the my main phone number, and it's 785-350-4569. 785-350-4569, and I will get right back to you and make sure that you get your needs taken care of.
Thanks, Heather. And we have a question from Barbara. It looks like Columbia VA. Does the VA have nursing facilities for women as well as men?
This is Dr. Holzmer again. So nursing facilities, I'm not quite sure what she's asking.
Yeah. I'm not sure either. Does the VA have nursing facilities for women as well as men? I'm not sure either. Barbara, if you can call back in and maybe identify what you mean by that, that would be really helpful. Great. We want to be able to address all of these for sure. All right, this one is from Rochelle. She travels, is why she has not been to the VA for her care. She can't get an appointment in a short period of time. She moves around every 3 weeks. She travels in an RV. Her primary care quit and is getting a referral, and needing the referral is hard.
This is Lori. Can you hear me?
Yes.
So at each VA, we now have a travel veteran assistant that can help veterans who do travel to multiple locations in helping them set up their care across that timeline. So I would make a recommendation to contact the closest VA where you're located currently and ask for the travel veteran coordinator.
Okay, thank you for that, Lori. All right, this one is from Angela. I go to the Women's Health Clinic and I love it there, but sometimes I have a hard time getting a referral. Can somebody help her out with that? That's a 785 area code.
Hey, Andrea, it's Jen.
Yes.
I'm sorry, you said that's Laura?
Her name was Angela.
Angela,
Yep.
I'm sorry. And Angela,
Okay.
I'm sorry, Andrea, what was the question? She belongs to the women's clinic and she's having issues with getting a referral.
She's having a hard time getting a referral. So I'm not sure, community referral or within the VA referral.
So Angela, first thing first is, you can always contact there's the WVPMs at each site or the Women Veteran Call Center, because again, those Women Veteran Call Center, they come directly to the WVPMs at each site. But I would start with your provider. So if, I know that's, so I would call the clinic. I would ask to speak with the RN care manager or the RN coordinator that's associated with your provider. And, and if you have called and you haven't gotten a call back, then you could do secure messaging. And that's why I love My Healthy eVet, because those secure messages come directly to the PAC team. But if you've done all of that, please, by all means, contact the Women Veteran Program Manager and or the patient advocate and just let them know, hey, I'm having a difficult time getting this referral in place. I'm not sure, where the miscommunication is, but I'm doing my job as the patient and I just need follow-up, and I can guarantee you'll have, follow-up very shortly after that. So you should not have issues getting your referrals in. So there must be, same thing with the community care referral, your primary care provider or your women's health provider puts that in, and then the community care team contact you. So just let your clinic, your provider, or the PAC team, the staff that are working with your provider know, or your Women Veteran Program Manager, or even the Women Veteran Call Center, whatever you choose.
Great, thank you, Jen.
Welcome.
So our next question is from Julia from Truman. It seems like it's hard to receive women's center health care and we have to jump through a lot of hoops. How are you making it easier to get health care? Is anybody on from Truman?
So I'm gonna speak. This is Jen from St. Louis.
Yeah.
Sorry, Andrea, and sorry for the delay. My phone takes a few seconds. So no, you should not be having difficulty getting women-centered health care. We have women's health providers that have extensive training in providing comprehensive healthcare services to our female veterans. We have a women's health PACT team. So the PACT means Patient Aligned Care Team. And so that the entire team, so the provider, the nurse, the LPN, all of them, and the MSA are all, intertwined and available for our female veterans. The VA is very forward-thinking. Our executive leadership teams have been very supportive. The whole reason why we have, even with this tele town hall tonight, is to emphasize that, we are building our facilities and, providing services that are directed for our female veterans, not just our male veterans. I would, really, really reach, I'd request that you reach out to your provider, also the WPM, reach out to Cindy Stivers and, let her know, hey, I need to have this, I need to be seen by this provider, I need this taken care of, and I'm having some issues getting that done. a lot of, I know I keep talking, but a lot of our sites, we just, even nationally, they're really focusing on our female veterans, and they're recognizing and they're, funding our facilities so that we can have staffing to meet your needs, so that we can have pelvic floor physical therapists, so we can have, whole health and those items that are geared, services that are available for our female veterans. So I know everyone on this call is very passionate about our female veterans, and I don't want to lose sight that, yes, we still have a ways to go and work through, issues, but we're on, we're all fighting for that. So, please don't, I know it's frustrating, but please reach out to the Cindy, or I believe you said Truman, so reach out to Cindy Stivers and let her, let us work that through for you, and we'll, get you the care that you need.
Great, thank you for that. And there's one from Mimi in Wichita. Is there a family counselor? Her family dynamic weighs on her mental health. Is there support for a counselor? Is there a way for her to get it from the VA if necessary?
Oh, this is Lori. Can you hear me?
Yep, we can hear you.
Okay, so in Wichita, oftentimes there are services that are available for the veteran and spouses and family members. I also recommend at times the vet center. Veterans who are in combat time period can go there, but also if you're needing some assistance family-wise with children aspect, we have family counselors that are with our vet center, and they are willing also to work with veterans who may not be in combat time, but will help them after a visit or two to transition to some community services that may be there specifically if you're looking at needing services for a family member that may not be a veteran. But we do also at our mental health facility have you can come in Monday through Friday, 8 to 4:30. We have a triage group that sees veterans at any time who have a mental issue that they would like to discuss or some family issues and they need to speak to someone. That is open as just kind of a place to come in and find out about resources there as well. My number, actually, if you need to call me and find out about more resources for the Wichita area, my number is 316-685-2221. It's extension 58064. That's 316-685-2221, extension 58064. And I'm happy to assist any women in our Wichita area.
Okay, thank you, Lori. Got another question. Let's see. This is from Kyla of Poplar Bluff. What is the VA doing for pain relief for cervical biopsies and pap smears as they have typically been pushed off to suck it up? How is the VA going to ensure that veterans do not want the COVID shot due to religious and cultural beliefs? Are they treated the same? So we'll start with question number one, Martini. What is the VA doing for pain relief for cervical biopsies and pap smears as they have typically been pushed off to suck it up? Or Dr. Holzemeyer, if you could answer that too.
I didn't want to step on Martini's toes in case she was going to answer. I think that there is a level of discomfort for many procedures that patients go through, and everyone has a different pain threshold. So I think it's important that that discussion happen with the provider before any procedures are done. If pain pain control is an issue, that needs to be discussed up front with a provider so that they can make sure that you are comfortable during your procedure. Some people do not tolerate procedures well, and we're very aware of that. So I think that really has to be a very individual discussion. Some women, women are a pretty strong group of human beings. They give birth to babies, and I don't know that our menfolk could actually tolerate that. So I think it has to be an individual discussion with a provider prior to a procedure. If you have fear of having that pain, or if your pain threshold is such that you feel that something would be needed so that you could get through that procedure. And Andrea, I don't know what the second question was.
It was about the COVID shot. It says, how is the VA going to ensure that veterans who do not want the COVID shot due to religious or cultural beliefs are treated the same? It got cut off, so I'm not really sure what that end part is. I apologize, Kayla, for that, or Kyla. But it looks like she's asking about the VA not treating anybody differently, whether they had the vaccination or they did not.
We don't treat anyone any differently, no matter what their preferences are for their health care, for their immunization status. I think it's been a real trying time for all of us, and for you as well, I'm sure. COVID has just been so unrelenting, and it's your body and it's your choice whether you receive that vaccine or not. We, of course, always will encourage health care and immunizations of all types for all of our veterans, but we will never treat you differently if you ever decline or accept a vaccine. And I hope that is your experience when you come to the VA.
Absolutely. And then Brenda from Kansas City, what do you do with your primary care doctor if you're not comfortable with them and they just don't click? What can you do? Absolutely call me, Brenda, and we can talk about that, look at that. You don't have to stay with one provider, and this goes across the board for everybody. If you feel uncomfortable or there's just something that's not working or clicking, call your WVPM, which is your Women Veteran Program Manager, and or that, the 800 call number, and I'll give that out again towards the end. But that's what we're here for, is to ensure that you feel comfortable, you feel that there is a relationship and a connection, especially with your primary care doctor. So Brenda, definitely, I will actually reach out to you. I see your number on there, so I'll call you tomorrow if that works for you. All right, I believe we have time for one more question. You guys, this has been amazing, and your questions are so good. And again, as we said in the beginning, we probably are not going to get to all of them, and so please reach out to us. Again, call the number, the Women's Call Center number also. Some of these are great for eligibility, and I just want to refer you back to, the va.gov that Jen talked about and our benefits officer talked about. Last question is from Paris in Topeka. 2 C-sections, checked out community hospital into a VA hospital to get pain medications. What can be done to save time, especially for women that have given birth via C-section?
Hi, this is Heather from Eastern Kansas. We have 2 maternity and mammogram nurse navigators that I would encourage, you to work with as far as any maternity care needs related to that. So feel free to give me a call and I can put you in connection with them. Once again, my number is 785-350-4569. And or I can reach out to you if you've given your phone number.
Okay, great. Thank you for that, Heather. All right. Well, we are coming to an end of our live event this evening. We knew that hour would fly by. We want to thank you again for taking the time to join us this evening and learn a little bit more about important updates within our VA medical centers. We appreciate the opportunity to have spoken directly with you, whether it was through the staff or Facebook, however we were speaking. and get to answer your questions, get to know more of what we couldn't answer tonight, and we're very much aware of all of that. This will not be our last virtual VISN town hall meeting or other local events that will be hosted in the future. So please follow your local VA Facebook page, your Twitter, sign up for My Healthy Vet. Different events and important healthcare updates are found on those different things. And now that we know you guys like the mail and different ways like that, we'll definitely utilize that a little bit more. I also want to give the Women's Call Center again, and that number, it's 855, and it's VA Woman, so WOMEN, women. And there you can text 1-855-828-6636, which is the same number. So you can text it or call it, whichever one you would want to, for more questions to be answered. If you're not a current patient, we encourage you to visit any of our eligibility and enrollment services for your information. Every VA has a VBA officer, so a veteran benefit officer should be at your main campus that you can talk to. I know here in Kansas City, ours has walk-ins where you can come sign in and talk to somebody that day about that. And so if you wanted to increase any of your eligibility, you can go back in that way. I saw a question about how do I get my medical records. I would definitely, there is a website you can Google. Forgive me, I don't know it right off the top of my hand, but you can Google that and just say looking for DD-214 or medical. How do I get my medical records? And that will pop up for you to follow. And or please reach out to your WVPM, your Women Veteran Program Manager, and they can help you find those too. Registration, if you call registration, which would be your main number to your VA, they can also give you different ideas for obtaining your medical records also. So it would depend on, where those might be. And so with all of that, the eligibility enrollment section process applications for enrollment into the healthcare programs can determine the eligibility for medical care, some dental care, long-term care. Your local staff will update the information regarding financial assessments, increase change in priority groups, and or provide advice and assistance on special programs and services that are available at any of your VA medical centers. So in that hours of operation are Monday through Friday with the exception of federal holidays, 0800 to 1630. And so that is what we have for you all tonight. We thank you again for joining us, and have a good evening. Be safe, and stay tuned for our round 2 for our next VISN 15 quarterly meeting, town hall. Y'all have a good night.